session we are going to discuss ischemic heart diseases. Ischemic heart diseases are diseases that occur in the heart due to decrease the blood flow and decrease the oxygen delivery to the heart. In a normal person, the normal blood flow should look something like this. But in ischemic heart diseases, we are faced with an occlusion of this lumen, leading to decrease the blood flow and decrease the oxygen delivery. And this occlusion occurs due to atherosclerosis. Atherosclerosis is the buildup of cholesterol and fat material in the lumen, leading to its occlusion. The first ischemic heart disease we're going to discuss is stable angina. Stable angina occurs when the atherosclerotic plaque closes more than 70% of the lumen of the coronary artery. During rest, this may not cause symptoms, but problems arise when the myocardial oxygen demands increase, and this occurs during exercise. When the oxygen demands increase, the body will fail to compensate because of the occluded lumen, and this will give rise to the symptoms of angina and the symptoms of ischemia, which is chest pain. Actually, angina means chest pain. So, stable angina occurs due to a stable atherosclerotic plaque. That's why it's called stable. And it causes exerginal chest pain, and this chest pain will be decreased with rest and nitroglycerin. As nitroglycerin mechanism of action is vasodilation of the coronary artery. And ECG will show ST depression. The problems does not stop here. With time, the atherosclerotic plaque will not stay stable. It may rupture, leading to the formation of a thrombus, This thrombus will travel across the lumen to give rise to what's known as acute coronary syndromes. We have three types of acute coronary syndromes that you need to be familiar with and be able to differentiate from. The first is unstable angina. The second is non-ST elevation myocardial infarction, and the third is ST elevation myocardial infarction. In stable angina, the thrombus leads to ischemia of the inner layer of the heart. It's called the subendocardial layer. And this layer is the layer that's most prone to ischemia because it's the inner layer and it's the furthest away from the coronary artery, which travels in the wall of the heart. Okay, and this is an ischemia, it's not an infarction, so we will not see an elevated cardiac biomarkers, and in ECG it will show up as ST depression. The next syndrome is non-ST elevation myocardial infarction. It's basically the same as unstable angina, but here it developed into an infarction. The subendocardial layer suffers infarction, not just ischemia, which means that there is cell death, and cell death means that we have elevated troponins. This syndrome will also appear as ST depression, just like unstable angina. The last one and the most dangerous one is ST elevation myocardial infarction. In this case, the infarction has progressed to involve all layers of the heart, causing transmural ischemia and transmural infarction. Hence the name ST elevation myocardial infarction. It will show up as ST elevation in ECG, and of course because that there is infarction, cardiac biomarkers will be elevated. Lastly, there is a special type of angina called vasospastic angina or Prinzmetal's angina. This type is not caused by atherosclerosis, unlike other types. It's caused by coronary artery vasospasm. This spasm leads to decrease the blood flow, leading to ischemia. And the triggers are smoking, stress, cold, cocaine, and hyperventilation. Actually, hypertension and hypercholesterolemia does not play a role in this type of angina. Symptoms are resting chest pain that occurs at rest, at night, and early mornings, and it will appear on ECG as transient ST elevation. This concludes our topic, and thank you.